Hello, I'm Dr. Aleah Gibson with St. Elizabeth Physicians. I know as a parent that keeping your family safe during the summertime is very important. So I want to share with you a couple of tips today. Right now I would like to discuss sunscreen. There are tons of different kinds of sunscreen on the market, but I want you to know how to choose the right one. Sunscreen is actually considered an over-the-counter medication by the Food and Drug Administration. On every sunscreen container, you should see something called an SPF or sun protection factor. That tells you how effective the sunscreen is. If it says SPF 10, that actually means that you have 10 times the amount of time before injury happens than if you had no sunscreen on at all. So please keep that in mind. Those SPF numbers are time related. A few of the things that we commonly do wrong when we use sunscreen are lack of applying enough. Most of the time we only apply a small percentage of the sunscreen that we need to apply. Actually, about 2 tablespoons is what you need to cover an adult body well. The other thing that we tend to do is buy SPF values that are higher, thinking that they'll give us more protection. SPF values higher than 50, while they don't give you added protection, can actually cause skin reactions because of the chemicals in them. I stress to you to use an SPF that's 35 at least every day when you're outdoors, and a 50 is usually a good bet for good sun protection. Make sure that if you're in water, that you are reapplying your sunscreen every time you get out of the water. There will be directions on your sunscreen bottle that tell you how often to apply it and when you should apply it. Follow those directions because that is how we know that sunscreen is the most effective. For more information on this topic and any other, please visit smarthealthtoday.com.